One of the major challenges affecting all health systems in developed countries is the ageing population, and with that ageing population, the increasing burden of disease. Most specifically, the rise in long-term conditions, the sort of things like diabetes, heart failure, that affect people as they grow older, often multiple long-term conditions affecting people at the same time. Estimates show that the cost of treating someone with 3 long-term conditions is 8 times that of treating somebody without a long-term condition. So it's easy to see that as the population ages and as long-term conditions grow in prevalence, we're going to see a cost explosion in the health system. Now, if any of that rising cost is going to be mitigated, at least in part, there are a number of things that health systems need to do to address that challenge. The first thing is to invest more in primary and secondary prevention of disease. Now, this is both at the individual level, changing the health behaviours of individuals, equipping them to live healthier lives, and when they've got a disease, to cope and manage that disease effectively. But it also has an effect at national policy level. A good example of this has been the public smoking bans that we've seen recently introduced in a number of countries that are already beginning to show health benefits. The second element must be to invest in more community-based services and care processes to support older people in their own homes and stop them requiring admission to hospital. This sort of care needs to be flexible and needs to be adaptable, because it has to be able to respond very quickly to fluctuations in the care needs of people at home. And evidence again suggests that if that responsive service isn't there, people will end up being admitted to hospital as a default. And once they're admitted to hospital, often those social networks and the ability to live at home begins to deteriorate, and they become hospitalised and less able to live independently. The third element of this strategy is to support patients to self-manage their care, to give them the ability to both understand their disease and take responsibility for it. Evidence tells us that effective long-term condition management is not something that can be simply provided by professional healthcare givers. It needs to be something that actually is done in partnership with patients themselves. This again is at the level of the individual, where they can receive training in how to be what's often called an expert patient, but it's also about creating social and community-based networks that support people in their own homes. So those 3 ways of addressing this challenge are all important, but they also imply some quite important changes to the way in which health systems deliver care. At the moment, health systems often provide rewards and incentives for hospitals to produce as much care as they can, to treat as many patients as they can. And these are short-term rewards. What health systems need to do in future is to reward healthcare providers to work together, to integrate their care around that of an individual. And often this will be about trying to reward them for reducing the requirements of care rather than providing care itself. So a good outcome into this system would be an older person who no longer needs to be admitted to hospital, but instead having hospital specialists and community-based services working hand in hand to support them in their own home. And that's a different sort of structure of care that we have at the moment. Similarly, we need to take a longer-term view over the rewards and the incentives that are within the system. At the moment, people are rewarded for providing an episode of care. In future, we need to have people rewarded for keeping people well over 1 or 2 years. And that way, they will be incentivized to provide prevention rather than simply treatment when it's required.